Hello, this is Dr. Eric Prather, your Louisiana chiropractor, coming to you from Lafayette, Louisiana, Prather Chiropractic Services. Today we have Lacey with us, and Lacey's a lab tech at a urology clinic here in town. And she came in because she was having symptoms of neck pain and cervical vertigo. Now, were you officially diagnosed with that by a urologist or another doctor? Or that's just been kind of your take?
Yeah, it's been diagnosed in the past by a chiropractor and orthopedic.
Right. So we did an exam, an x-ray exam on Lacey, and we found some interesting findings in her cervical spine. So if you can zoom in here, Megan, can you see that okay? All right, now here we have a lateral cervical. This is the lateral cervical view. This is the jaw, these are the teeth, this is the skull, and these are 7 bones of the cervical spine. What this white line represents is the attitude of how Lacey's neck should look. And if we look here at the vertebral bodies, the body of the spinal segments, we can see that they do not follow this line of curvature. So we refer to this as a cervical kyphosis. And that is almost always the result of a hyperflexion, acceleration, deceleration, acceleration injury, like a car accident. Well, as we went through Lacey's history, as it turns out, 2 years ago, you were rear-ended, really bad collision. A collision so violent your car was thrown into a house and your head went forward, it went backwards, and this is the result, okay? Injuries like that will damage a ligament at the back of the vertebra called the PLL, the posterior longitudinal ligament. You usually tear it, if not partially, fully. And as a result, you have biomechanical change of these segments. These segments start moving wrong as a result. The vertebrae start rubbing together in a way they're not supposed to. Then they degenerate, okay? And that's what we're seeing here at the C5, the C6, C7. You're getting some bone spurs called exostosis. That's a radiological term for that. You're getting some degeneration of the discs in the middle. And we can see what's happening with the curve. So conditions like this, aberrant motion in the spine, especially in the cervical spine, can put pressure on your spinal cord, pressure on your spinal nerves, leads to headaches, leads to the cervical vertigo, leads to neck pain, radiculopathy, numbness and tingling down the hands, a lot of serious stuff. And usually these things go undiagnosed long term, they continue to degenerate, and then a patient ends up on a neurosurgeon's table where they just start cutting parts out and bolting stuff together. So we don't want that.
No.
And you went through some treatment and nobody told you this, right?
No.
Did an MRI even. Nobody told you this.
No.
And I see that so often. Patient comes in, they've been through what I call the medical gauntlet. They've seen doctors and chiropractors. They don't even have an accurate diagnosis. They have no idea what's wrong with them. So over here, obviously we start with a good diagnosis. And then we use proper chiropractic technique to try to help you with some of this stuff out, okay? So that being said, I think you're gonna do well. It's just a matter of doing some treatments and seeing how you respond, okay? Doing some decompressive adjustments, trying to get some movement back in these joints, getting some inflammation out of there, and see what your body reacts to it.
Okay.
Getting that vertigo under control. All right, you have any questions about this before we get started? All right, we're gonna start things out on what's called the biophysics table, where we're gonna do a full spine adjustment, and then we'll end things with the decompression procedure on the ring dinger table, okay? All right, let's go ahead and go face down right here for me. Basic head on the paper. Okay, go ahead and scoot yourself down. All right. Leg pretty good. Let your knees bend for me, Lacey. There we go. All right. Now you also mentioned some irritation and tenderness in the SI joints.
Yes.
Do you have any pain under my thumbs here?
It's more center.
Yeah, more in the center. Mm-hmm. And that's what we saw also on the x-ray, was what we refer to as a base posterior sacrum. So we're gonna get that adjusted as well. Checking your spinal tone here. Got some fixation through there. All right, well, let's get started with that sacrum. You're gonna feel the table jump up. We're going to shoot that P to A. Okay with the pressure, Lacey? Okay. Good release there. Good release. Okay, good release. Okay, we're going to slide you down for me a little bit. Okay. That's a heavy adjustment. It's a little deeper than it looks. So now we're going to kick the head up, start working on that neck, pushing that curve back forward, okay? You are tight. Okay, let's go ahead and roll it over. Tight, tight, tight in there.
Oh.
Yep. There we go. Now we're going to work on bringing the head back over the shoulders.
Okay.
Okay, let's take your arms, Lacey. I want you to open up real big. Fire off those shoulders and clavicles, rib cage. Remember how you said gravity felt like everything's pulling you forward? Mm-hmm. Well, we're doing the opposite of what gravity's doing to you. Okay, hands on the tummy, ma'am.
Oh, that feels so good.
Yeah. She felt that and even into the lower back there.
Yes.
Okay, very good. Come on up. Okay, let's spin you around this way. Yeah, you have a lot of scar tissue in there, in that cervical thoracic junction. It's gonna take a little work.
I feel good.
Now we talked about using a rolled up towel to sleep on, sleeping flat on your back. Anything we can do to start encouraging that lumbar, that cervical lordosis to return. McKenzie exercises, extension exercises. We're going to review all that too.
Okay.
All righty, ma'am. So far, so good.
So far, so good. Oh, good.
Okay, let's get you over here to the decompression table. Lower that a bit. Hop up there. Okay, we're gonna have you sit right here, then lay back this way, head that way.
Okay.
Okay, I'm gonna get your pelvis lined up here. Okay, I'm gonna put the spine in neutral by lifting the legs.
Okay.
Put your hands on the tummy. Just dead legged for me. You'll feel that table rise. Also a good position to sleep in. When you have that towel under your neck, you can take a laundry basket, turn it upside down, put a pillow on top, put your feet just like this. You can train yourself to sleep that way. It'd be good for your spine. Okay? Take a little practice, but why not? All right, we're gonna stabilize your pelvis with these pins here, Lacey. It's gonna be a tight squeeze. Just breathe through the nose. All righty, ma'am. Good. So far, so good. You okay there?
Yeah.
Okay, lift the head for me. Now you want to keep your back teeth touching, Lacey, not clenched, but touching. Breathing through the nose, tongue in the center of the palate. Big breath in for me, and out through the nose. Breathe, breathe, breathe. Don't forget to breathe. We hit that one pretty good.
Yeah.
How far down?
All the way.
All the way, huh?
All the way.
Yeah. Never been adjusted like that, huh?
No.
No.
That was amazing.
Awesome. Tolerated it good.
Wow.
Yeah. All right, let's finish clearing that neck. I'm gonna work in that low C5, C6, C7. Let me have that head there. Okay, good. Still getting some release out of that. Loose loop. Good release. All right, my lady, you're done.
Oh my God, Dr. Prather.
Okay. Hey, you can sit up. Give us your reaction and how you feeling. Sit up. There you go. You good there?
Yeah.
All right, let it settle. Let it settle. All right, we're gonna repeat that a few times.
Okay.
Break up all that scar tissue in your neck. Break up that scar tissue in the lower back too that we saw in the X-ray. We didn't go with that on the video, but yeah, we got a little work to do. But I think you're gonna respond well. And after we get things cleared out, get your joints moving right, get your symptoms down, you know, you get your tires rotated every so often, and you should be good to go. You have any questions for me?
Nope.
All right. We are thankful that you let us record this encounter and share the information with our YouTube audience. We're trying to do these educational videos to hopefully reach some people that can benefit from our services. If you're having challenges with your spine, if you're having pain, check us out. Please like, subscribe, and share these videos with your family and friends if you think it can help. And we're here to help people that are having some problems with pain. They want to eliminate use of drugs, want to lower your risk of surgery. That's what we hope to accomplish here at Prather Chiropractic. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.